Thank you for joining us for this episode. Today, we're joined by Dr. Mila Ioussifova, and we're going to be speaking about IPL in your practice. I don't have enough space on the OI show. Hey, before we get started with Dr. Ioussifova, I want to thank Luminous for their support of this podcast. As you know, Luminous is the inventor of IPL, and they've presented the first and only IPL that is FDA approved for the management of dry eye disease due to MGD. Introducing OptiLight, a bright solution for dry eye. Elevate dry eye management with Luminous's patented optimal pulse technology, or OPT. Get the safe, precise, comfortable, and effective therapy your patients need to manage dry eye disease with OptiLight. And now back to the show. Thanks again for joining us. Mila, it's good to hang out with you again. How are you on this beautiful day?
Thanks for having me back. It's always fun.
It is. It doesn't look like it's raining in Portland today.
Nope, it's beautiful.
Yes.
How's Seattle? Same.
Seattle is the same. We oftentimes have similar weather. I was blessed to get to come down and visit your practice a few months ago when I was in Portland. Thank you for hosting me. Incredible. I love to get to know you and to get to know all the amazing ways that you're crushing it. When I hear about you having an interest, like you are somebody who like digs in deep when you've got an interest, right? The fact that you went and got your master's in nutrition because you thought maybe there's something about the tummy and dry eye, right? When it was like, maybe eye drops that are bloody we should make bloody eye drops for people. You're like, oh, I'll go and become a phlebotomist, right? I love that about you. Have you always been that way?
Yeah, I think it's a blessing and a curse because, the saying, fake until you make it. That's one of the best things I actually learned. I feel like it was in my probably internship as a third-year student. But then really my personality is not to fake it. I really want to, when I'm talking about something, I really want to know what I'm talking about. So that goes for nutrition. When I was learning about the connection with, obviously, I mean, this, you didn't even have to go to school to know that nutrition affects everything. But when patients were asking me, what should I eat? What should I not eat? Does this have something to do with my, gut problems that I've had for a long time? So I wanted to really learn it at the, more of a cellular level. So, so I think the fake until you make it, works maybe in the beginning, but then when you really want to know what you're talking about, for me personally, it's really, I need to learn things at the deep level. Same thing with like PRP eye drops and autologous serum. A lot of the limitations with those processes was that there were so many different protocols. So when I start working on PRP protocols, I went and got a hematology analyzer. I mean, this is something that's really just available in lab testing. When I was getting it, they were like, what do you want this for? What are you doing? These distributors, it was really funny to, like, we've never seen an eye doctor or any, clinics carry this. I'm like, well, it's just for my own research. I want to know exactly what I'm making. Are the platelets, is this therapeutic level of drops that I'm giving to patients? So yes, I think like I said, it definitely could be a curse, because then I just go into this rabbit hole, right? The more I learn, the more I'm like, oh, I need to learn more.
Yeah. I love that about you. And I love whenever I talk about you, you always take this level that everybody else has and you take it to this next level. So I want to share with everybody a little bit about your practice. So your practice is the practice in how it looks that everybody wants to have, right? They've got this beautiful setting, kind of close to the water. You can overlook the water. It's not too far away. It's in this little community outside of Portland where, people live in apartments, and it's like this beautiful, beautiful setting. Inside of your practice, you have decorated it in such a way that it is hip and it is fun and it is elegant and everything. And then you step behind the optical, and it's like a postage stamp, super small space. Like your clinical area is not huge. And you have done this incredible job of setting up your practice in a very small space. And it's like I expected there to be all this other stuff that was going on behind the scenes, but you have efficiently fit it all in an amazing area. And I hear all the time, and I know you do too, because we spoke about this offline. Like, I want to bring in whatever it is, another specialty or whatever it is. In our case, I want to bring in IPL because you're one of the original, you're one of the OGs on IPL. You've been doing it forever. But I don't have the space. And was that something you thought of? And I don't mean to say your practice isn't capable of doing the things that you do. It's just you bought the space and you've made it work. But did you question, can I bring stuff in? Or did you always just say, we're going to find a way to make it work?
Yeah, always find a way. We're going to make this work. So going back to 10 years when I opened this practice, this was, it's a cold start. And I'm looking at all the different, areas in Portland. And this is actually considered in Portland. So this is South Waterfront area of Portland. So it's just outside of downtown. So it's literally, which really nice because we've avoided all the chaos of downtown. But it still has, it's a very centralized, location. So that was very key for me to find a place that was like center of Portland without being like downtown Portland. So it has all these condos and all, the hospitals down the street from us. And that was also another thing, like, some people were like, oh, that's a bad idea. There's ophthalmology there. They have a eye clinic and you're going to be competing with that. And that never really was a threat to me because I knew that I'm going to be offering different things. I'm not going to offer the same optical that they have. I'm not going to offer the same services they have. So I had to make myself different, and that comes with the specialty, like dry eye and having these advanced treatments like IPL and things like that. So pretty much early on I knew that I'm not going to be the same type of clinic that's just literally down the street from me. So and the funny thing is, when we're looking at different locations, we looked at several one, and this was actually an established business. It was a dog grooming business, beautiful, overdone dog grooming business, and they were not doing well. So this is, again, for someone who's starting out and looking for locations, this is something, a tip to maybe visit some local businesses. And this particular one, she just was like, I want to close. And so we went to her tenant or to her landlord and offered to basically buy the space. So as far as like initial investment in tenant improvement, or the build out was so small, because that when you walk in, that big wall that you see, the round wall, was already built. That's, that was already there. All I had to do is put little, rooms in the back. So it was like open space in the front and open space in the back. So I built exam lane and I built a pre-testing room. That was it. That was all that I could do, right? And then on the side was my office initially. So that's where the previous business had their office, which is beautiful space. You saw that, like huge windows, 15 feet or 20 feet wall of windows. And it was initially my office, just my desk with like my bookcase and like books that I never really needed. So it was just like a space that it was great to have like my meetings, like if I was hiring someone, like interviews and things like that. It was a beautiful office. But when I started to look at these, like IPL, bringing something in, first I brought in LipiFlow, and that was easy to just put on the desk in the exam room itself. Yes. So that was easy implementation. But then with IPL, it was too big for the exam room. So instead of, initially we're like, okay, we'll wheel it in when we're doing a treatment, but pretty soon that was obvious that that was not going to work out, because it was just getting in the way, like, bringing it in and out, because it's on wheels. And so then I thought, okay, my office is not making me any money. It's just this space that I clutter, to have my books and my papers, and once in a while I'll have someone there. So we basically took everything out and turned my office into a treatment room. So we got a chair, we got our IPL, we put our LipiFlow in there. It became our treatment room, our dry eye treatment room.
Before you dig into what's all in that room, but what about everybody else in your office? I mean, did you like really upset the apple cart when you're like moving away from, not having a big staff area and, not having big areas in your space? Or as a business owner, were you thinking, I want to maximize the square footage in my space that can generate revenue for me, which you later went on to do with a closet and your PRP and your, all the blood work that you're doing. Is that kind of your mindset is maximizing square footage revenue?
Yes, maximizing for sure. We're 1,200 square feet of space, so it's not huge. So it's
but
definitely
beautiful. It's very elegant.
Yeah,
I love it.
It doesn't seem crammed at all, especially in the front that has that really big space for optical. And that was important for us to keep that first initial, like when you walk in, you don't want to see, you want it to be open and beautiful and not crammed. So we kept the optical really, put a lot of the square footage in there. That was, again, that wall was already there, so we just didn't have to move anything. And in the back, we had to be smart with our space and utilize everything. So the office space, that was where my treatment room is now, it was really not for staff anyway. So it's not like I took away like a lunchroom from them. It was really my personal office, and maybe the manager, the manager and I would have meetings and things like that. So really, I just took it for myself.
So, if other doctors are wondering, well, I couldn't give up my office. What you were interested in is walking away with more revenue and being able to treat your patients better, more than having a place to have meetings with your office manager.
Yes. Especially since, IPL later led organically into doing more aesthetic treatments. And then I delegated, I got advanced estheticians. Actually, one of them was already in my practice, and I just paid for her school to become an esthetician. So so that freed up my time. So instead of doing exams, but also running into the treatment room to do IPL treatments, then I was able to delegate treatments to an advanced esthetician who studied, IPL and all of that in school. So she was actually more knowledgeable about the skin itself.
Yeah. So the way you started this, though, is, there's some people who are like, well, I don't know that I really want to do aesthetics, and so I shouldn't bring in IPL. But that's not where you thought. Like, you were like, okay, we're doing LipiFlow. The next thing we need to do is treating this. But this is years ago that you did this. So how did you decide to bring in a luminous IPL device? Like, how did you decide on the Luminous device, and why did you decide you needed to go to the next level in dry eye treatment?
So this is back in 2016, and I already had LipiFlow for some time, probably a couple of years, and I was seeing limited results with my rosacea patients. So all those patients with telangiectasia, non rosacea or lids that didn't have telangiectasia, LipiFlow worked really well. But with patients that had a lot of lid, scallop lid margins, that hyperkeratinized with telangiectatic vessels, those patients were not responding well to LipiFlow. And then that's when as Dr. Toyos this was early on, but there was already a lot of evidence and research that was being released on IPL. And I actually went down to Nashville to his clinic to really learn about IPL. As you know, I don't just get something without really learning. So I went and did some hands-on training with him, but also really learned about it from him. This is again back in 2016. So when I when I brought in LipiFlow, IPL, that's when I saw a huge improvement in those with dry eye patients that had rosacea component, that ocular rosacea component. And so treating the lids, then obviously with his protocol and also Paramin protocol, you're including, the cheeks and the face, and patients were seeing the aesthetic benefits. Again, that was the bonus. I did not start this with any interest in aesthetics. For me, it was just treating dry eye and doing more for patients that were not responding to the initial thermal treatment. So it's more
if you had to guess, so you bought this device in 2016. I mean, you were an early adopter in IPL treatment in North America, obviously. How long did it take you treating dry eye before you got into aesthetics, before you paid for your machine? Do you have a guess? Like, do you think you did enough treatments in a year that you had paid for it, or do you think less than that?
I paid it off within a few months.
Wow.
I'm
See,
not
I
kidding.
hear that time and time and time again. And we keep hearing, from eye care providers who, number one is I don't have the patient base, right? You built that patient base. Number two is I don't have the space for it. And like you're saying, no, you do. And number three is I don't have the time clinically for that. That's another issue. Like, you were a busy doctor, right? People were coming in from all over the place. Although you were a cold start, you were already pretty busy. And it sounds like what you were doing is you were getting your staff to set these people up in this other room. You would finish up in the exam room, and then you would go over and do the treatment. And that's how you were starting. Am I assuming that correctly?
Yeah. I think and I unfortunately hear this from my colleagues too, is that because it's maybe something new to them in their clinical flow, they just think that this is something that's going to get in the way, and instead of enhancing their treatments and their patient experience, they think that this is going to actually disrupt their clinical flow. And I think you just have to it's just not true. And there's ways to do it yourself. I mean, when I started out, I was doing it myself before I started delegating. And obviously, just like you have your your days, and I had it. I wouldn't do it that way now, but in the beginning, I had like dry eye days. I had days when I was only treating dry eye patients, which now doesn't necessarily work because it's just like they're all dry eye days. But that's maybe a way to, if you think that there's no way to include this in your normal flow, have a day where you're doing treatments only. So that way you have dedicated a couple of times a week where you put on your IPL hat or your dry eye hat and treat those. And finding the room, again, for me, the unit, I have the M22, the original one. I think it's bigger than the Optilight. And what I first, it was on wheels, and then eventually what I did, I took it off the wheel. So I had to build a countertop, which you saw in my clinic, because I kept adding more machines and running out of space, and they all had really big base bases. So I built a countertop and took all those machines off their bases. So one countertop holds like 4 different machines now. So, and again, as I don't think I would have been able to fit them all in that small room because of their bases. So you just have to get creative, right? Of ways to add this, and it's so doable. And so, when my colleagues talk to me, I always say IPL is a no-brainer. You're gonna pay it off. You're gonna not regret having it. And you're going to help your patients. That's ultimately what we want, right? So patients that are struggling with dry eye because of rosacea, all the other treatments that they're doing at home or thermal treatments are just not as effective. And
Yeah.
patients know about this. That's the thing. When I first
Mhm.
started, people didn't know much about IPL. So there was a lot of education that I had to, spend time on telling patients like, this is used, this is safe, this is, for eyes. There's a lot of studies. Whereas now it's so easy to recommend IPL because patients are coming in already requesting it. They're like, oh,
Right.
I've seen, I've heard about it, I've seen it, I've done research, because these patients do a lot of research before they can come in, these dry eye
Yeah.
patients. So it's
Yeah.
much
So you
easier
said,
conversation.
especially for your rosacea patients, and then what just popped into my mind is is prior to me having a dry eye practice and then particularly going into treatment with IPL is how few rosacea patients I thought I had, right? For me, it was like, oh yeah, I prescribe Doxy 5 times a year. And so there's my 5 patients and I don't have enough. No. So think about it this way, is all the dry eye patients that you have, if you see telangiectasia on their eyelids, those are the people, right? It's not just these people who you see these huge red cheeks and this flare. Now, as I have so many primary care patients that come in the door, it's amazing how often I look at them and I'm like, oh man, you have rosacea. But before I had a treatment for them, I just ignored it. So if you're like, hey, I don't have the patient base for this, just start making a note of every day. Just go back to your office, which could be turned into an IPL room in the future, and put a little hash mark of this patient had rosacea, this patient had telangiectasia. You'll be surprised how many people really would be good candidates for this. And I didn't think that before, right?
Yeah, I agree. Same here. I mean, once you start looking for it or recognize it, you will see it, yes, all the time, all the time. And these are the patients who have Demodex, especially blepharitis. So think about how many patients of your dry eye patients have blepharitis. Most likely they have rosacea, ocular rosacea. Looking for patients, again, if you've done thermal treatments and they're not responding, some of these patients will say, actually, when I do warm compresses, my eyes feel worse. Again, suspect it's rosacea because you're increasing heat, and rosacea does not like heat. And recognizing that there's difference. There's a facial, rosacea, and there's ocular rosacea. If they have facial rosacea, 100% of the time, almost, they have ocular rosacea.
They
but
do.
it could be, but a lot of times it's the other way around. We'll see ocular rosacea years before they have facial rosacea. So a lot of times, we'll see all those telangiectatic blood vessels on the lids, and then you'll mention to a patient, they'll be like, I don't know, I've never had, I don't have that on my face. But then ask them like, what about your mother, your father? Ask like family history. They'll be like, oh yeah, she's got really bad rosy cheeks and, red nose. And so, that it's there. It's just, with younger patients, it's going to show up on the lids first, and then it will show up on their face.
Yeah, it's there.
It's there.
All right. Well, digging into all these things, I mean, at some other time, we're going to really dig into your aesthetics component of your practice, but we need to get more people who are purchasing their IPL to get them started before we even do that. You're crushing it. You've got makeup lines and facial treatments and skin treatments around the eye that just are unique to you, that nobody else in Portland has. And you're just crushing it. Thank you for, all the education you do on social media. I love seeing your posts and seeing what's new and what you're learning, and how when I see these posts about you, you're always driving me to do better and be a better. So where can other people find you if they are not already following you?
Well, those are such kind words. Thank you. On social, Instagram, Dr. Mila is my handle. That's the best place to connect because it's fun to connect there. And yes, when I get inspired, a lot of times I'll go through phases. I'll get inspired from my patients, encounters or things that I see that I like to share and educate other people out there. And then my email is drmila@swec, swec.us. So that's another way to connect if you have any questions for me. I'm always happy to give any feedback or give any advice on like starting a practice, adding dry eye to your specialty to your practice. I love talking about this, so happy to share any.
One other thing is, would you please share with people how they can help their patients on the nutritional side of things with some resources that you have available?
Yes. So as a nutritionist, I paired up or partnered up with another optometrist who's a certified nutrition specialist, and we've created an online program called Dry Eye Nutrition. And this, you can find this on I Thrive Wellness, so EYThriveWellness.com. That's our website. We have this program for patients that they can go get a lot of support and education on what to eat and what kind of supplements to take for their eyes. And then we have another masterclass that's for eye doctors. So if they want to learn more on gut health so that they can feel, empowered and educated to talk about this with their patients, that master class is available for eye care providers. And that's also on ithrivewellness.com.
Awesome. Well, so inspiring. I appreciate you hanging out with me and being part of the OI show.
Thank you so much for having me.
Yes. And thank you for joining us for this episode. Make sure to like and subscribe. Stay tuned for future episodes of how to help your patients and crush it in practice. I also like to thank Luminous for their generous support of this podcast. And we'll see you next time.